Hello, I'm Dr. Frida, and this is my practice manager, Shador, and welcome to our YouTube Live. You're here for another lunchtime live where I will be taking medical questions from you and answering them in real time. Today's topic, how to lower blood pressure naturally. Now that's actually one of the most common questions I get because as a nephrologist, as a kidney doctor, I'm in here specializing in hypertension, and a lot of my patients are on blood pressure medications. And even though medications are wonderful in the results that they achieve, a lot of medications have side effects. They can cause sexual dysfunction. They can cause depression, slow heart rates. Some of the blood pressure medicines can cause swelling of the feet and the ankles. And a lot of people try to do things naturally. So in today's video, I'm going to give you some ways to lower your blood pressure naturally and fast. That being said, you still need to do it under the supervision of a physician because for some patients, for example, patients with kidney disease, medications as initial treatment are a must for most kidney patients. Also, patients who've had strokes, heart attacks. Sometimes these natural remedies are good to do in addition to medication, but the natural remedies don't always work alone if you already have end organ damage. But for a lot of people, these natural remedies really do work. And so I want to get into some of them and I'll take your questions about them. So first off, what is high blood pressure? The definition of high blood pressure has changed recently. Normal blood pressure is a top number or a systolic less than 120 and a bottom number or a diastolic less than 80. If your systolic blood pressure is 130 or higher consistently, you have hypertension. That definition just changed in 2017. And then if your systolic blood pressure is 140 or greater, you actually have the highest stage of high blood pressure or stage 2 hypertension. So you may be listening to this video and you may just now be realizing that it affects you. So now, first off, I'll take some questions that we have, and then I'll go in and I'll talk about some just different remedies on how to lower blood pressure naturally. Ms. Shador, what questions do we have?
Yes. So this question came in from Donna Evans.
Hi, Ms. Donna Evans.
Hello, Dr. Frida. My question is, how can I help my mom keep calm and lower her stress level?
That's a very good question, Ms. Donna, because not being calm and having high stress is a definite cause of high blood pressure. What happens when you have high stress is that your body releases stress hormones, which are cortisol, adrenaline. And what these hormones do is that they cause the blood vessels to constrict or tighten. And what happens when you have tight blood vessels? The pressure against them is high. So stress and not being calm can definitely cause high blood pressure. So some things that you can do is you can have your mom to do slow, deep breathing. Just sit down, do slow, deep breathing. You inhale for about 4 seconds, hold it for 4 seconds, and then you release. What this does is that it causes the heart rate to slow down. It also causes those blood vessels to relax and dilate, and then the blood pressure goes down. Other things to do include meditation, exercise. It could be walking. There are even chair exercises that can be done, or swimming. Other things that can reduce stress, getting enough sleep, also proper time management. I want you to click in the link that we'll put up there after this live and look at my videos on stress and show these to your mother and see if you can help her to calm down, reduce her stress, and to lower her blood pressure. That's a very good question.
Good. I guess more so a personal question for myself. I have high blood pressure. You know, I may not look like I have high blood pressure.
You don't.
Was told that it's hereditary and given my age. With that being said, is there any ways that I can kind of minimize those statistics or reduce my blood pressure so I don't have to take my blood pressure medication?
That's a good point. And so thank you for sharing. So Ms. Shador just shared that she has high blood pressure. You see, she's very young, very slim, and in shape. And that lets you know, just because you may be young or look like you're totally fit and in shape you must check your blood pressure to find out if you have hypertension, because high blood pressure is a leading cause of heart disease, strokes. High blood pressure is the second most common cause of patients being on dialysis or having kidney failure. So there's no look to high blood pressure. You have to check. So yes, there are different things that can be done. And once you implement these natural remedies into your life, then it is possible to come off of the blood pressure medicine, again, under the supervision of your physician. So it starts off with lifestyle. So exercise. Most people should be exercising for 30 minutes most days of the week, or according to the American Heart Association, getting 150 minutes of moderate exercise or 75 minutes of vigorous exercise in every week. What this does is, again, it helps to dilate blood vessels, lower blood pressure, and it also helps to reduce stress. And you can lower those numbers by as much as 5 to 15 points, 5 to 15 millimeters mercury just by exercise. Now, if you're someone like you who's already pretty in shape, exercise may not make a huge difference. But for someone who's sedentary or kind of a stressed out, high anxious person, the exercise can make a huge difference. Another thing is having a healthy weight. Obviously, you have a healthy weight. But if you don't have a healthy weight and you especially have some abdominal obesity, belly fat, then getting rid of that can help decrease your insulin levels and decrease your blood pressure. Other things, foods. Foods are very, very important because a lot of foods have natural actions that do the same things as blood pressure medicines. So when you're here in the office, you see I prescribe a lot of diuretics or water pills. Diuretics help to decrease blood pressure by getting rid of excess volume or excess fluid in the blood vessels. And when you get rid of that excess fluid, that decreases the pressure on those blood vessel walls. But there's certain foods that are natural diuretics, such as celery or celery seeds. And so if you eat a lot of celery, or if you prepare the celery seeds, that can help you to get rid of excess water, like the diuretic, and decrease your blood pressure. So if you're taking hydrochlorothiazide, Lasix, furosemide, some of these water pills you may have heard of, if you're doing celery or foods that are high in potassium, like bananas, onions, strawberries, garlic, if you're taking foods that can have that diuretic effect, then that can actually potentially help you to reduce some of the blood pressure medications. Again, I'm not saying everybody throw your pills out and go get celery. What I'm saying is incorporate these things in your diet and then see if, my pressure is kind of low. And then go into your physician's office and say, hey, my pressure's getting lower. Do you think we can pull back on some of these medicines? You do it under the supervision. Some of the other things, so we mentioned exercise, meditation. Some folks don't take meditation seriously. But if you live in this high stress life, we all have these schedules. And most people are always kind of behind on that things to do list. You have stress even if you don't know you have stress. So if you just take a moment to meditate, there are even apps you can put on your smartphone, which will give you guided meditation. These are things that can help to decrease the blood pressure and help to kind of get you away from some of the medications. And the other things like tomatoes, which have lycopene, garlic can help to decrease the hardening of blood vessels, and they can help to lower your blood pressure. Spinach can help to do it. Lemon with lemon zest. The lemon zest or the peel has essential oils. These are things that can help to lower the blood pressure as well. And having a low sodium diet, which I'll get into as well. To answer your question, there's a whole host of things, but just kind of to start, you start with the lifestyle and then you consult your physician about trying to pull back on medicine if it's possible. And it won't be possible for everyone, but the natural remedies are certainly worth a try. And even if you still are on medications, these things are just good for your overall health.
Okay, well, thank you. We have viewer PK.
Hi, PK.
Hello. PK asks, does medical marijuana work to lower high blood rates?
That is a very good question. And with the medical marijuana, I don't have any large randomized controlled trials, meaning I can't sit here and quote you data and tell you as a medical physician if medical marijuana will decrease blood pressure. What I can say is having a lower stress, being calm, having less worries can help to decrease blood pressure. Now, if the medical marijuana does that for you, then for you, it may lower blood pressure. If the marijuana is something that's being inhaled into the lungs, you still will have some of the effects of smoke on the lungs, some of the negative effects on the endothelial cells, the linings of the blood vessels with that smoke, especially if the marijuana leaf is wrapped in tobacco. And so any kind of tobacco smoking is not good for the blood pressure. That can cause artery constriction or tightening. So if smoking is a whole separate story. But if you're talking about medical marijuana, that perhaps is something that's oral, under the tongue, something on the skin, and if it calms, reduces stress, it is possible that it will reduce your blood pressure. But again, I don't have any randomized trials where I can say, yes, everyone go out and get marijuana. It will decrease your blood pressure. I'm not saying that. But consult your physician, especially the person who prescribed the medical marijuana. And it is possible. It makes sense.
Thank you for your question, PK.
Yes, thank you, PK.
Pamela Rose, thank you for joining us.
Hi, Miss Pamela Rose.
Miss Pamela says, hi, Dr. Frida. I am hypertensive and there's a family history as well. I get very anxious. Can I reduce high blood pressure naturally? And I am taking medication.
Okay, yes. So the family history is a big thing. So you can be someone who is slim, in shape. You can be jogging in some cases. And if your family history is strong, then you may have that genetic predisposition to high blood pressure. Now, if you're running around here being anxious, Ms. Pamela Rose, on top of that, then yes, the stress, the anxiety will cause those stress hormones to surge and will worsen the high blood pressure. If you're on medications and you're in that group of people I mentioned, as in if you have kidney disease, any heart disease, heart failure, stroke, any of those things, then it's very likely that the blood pressure medications will help you. In fact, in kidney disease in particular, there are so many studies that show that medications can really help as far as improving kidney disease. And so I know a lot of my kidney nephrology patients are looking at this video and they're like, wait a minute, Dr. Fisher, why do you have me on medicine? Kidney disease is a whole separate bag. So that's why a lot of times my kidney patients, most of them are on medication. So I don't know if you have that, Ms. Pamela. But again, implement some of these lifestyle changes, including supplements. Fish oil is something, anywhere from 1,000 to 1,300 milligrams a day of fish oil has been shown to decrease blood pressure. And I do have some data from randomized trials to show that. There was a meta-analysis of over 70 randomized trials, and it showed consistently that taking fish oil helped to decrease blood pressure, both that systolic, that top number, and that diastolic. So, again, still have the conversation with your physician. Don't just stop your medication. Please don't do that. But see what happens if you implement something like fish oil in your daily diet, that supplement, and watch those numbers and have the close conversation with your physician. Other things, CoQ10 or coenzyme Q10. That is another supplement. It's found in the mitochondria of the heart, the liver, the kidney, and it's kind of like a vitamin. Studies have shown that CoQ10 can help in heart failure for sure, but they've also shown that CoQ10 can help to relax blood vessels and decrease blood pressure. There's some mixed results, but it is something, and again, consult with your physician, that may help you and likely won't hurt you, especially in conjunction with hawthorn berry or hawthorn extract. So again, take these medications, but then start adding some of these natural remedies in your life. Talk to your physician and see if you can come off medicine. I'm going to go back on that potassium, though. I mentioned earlier that potassium can help to decrease blood pressure in foods like bananas and things like strawberries, spinach, things like that. If you are a patient who is a kidney patient, you may not be getting rid of potassium out of your body like you should. So in that case, you should not be adding potassium to your diet. Most people who metabolize potassium normally should have like 4.7 grams a day. But if you have a kidney issue, then you need to limit it. I do want to take a second. So thank you for that question. I want to mention something. I want you to stick around to the end of this video, everyone watching, because I have something for you. I have a freebie. It's a free download for something that is going to help you to have a healthier life. So stick around at the end of the video. I'll tell you what it is. And you're also getting a preview because I haven't actually released this yet, but it's released to you. You can hang around to the end of this video.
All right. Sounds good. Thank you for your question, Pamela. We have Ms. Sharon.
Hi, Ms. Sharon.
My pressure keeps fluctuating. What can I do to manage that?
Okay. I want you to pay attention to the times, Ms. Sharon, of when your pressure is fluctuating. Is it going up when you're stressed out? Is it going up when you're anxious? Is it going up when you have a high salt diet? High salt diet. A lot of people say, oh gosh, I don't have a high sodium diet because I don't pick up the salt shaker. I don't add salt to my food. Well, there's a lot of foods, even healthy seeming foods, that have high sodium or high salt, even when you don't add salt. So for most people, they should be getting less than 1,500 milligrams of sodium a day. So number one, I want you to be a salt watcher, a label watcher of how much sodium you're taking in. And just a few examples that I've shared before. 2 vegetarian links of sausage, 300 milligrams of sodium. If you have just a tablespoon of ketchup, and y'all know y'all like more than just 1 tablespoon, that's 160 milligrams of sodium. And just a tiny little little teaspoon of salt has 590 milligrams of sodium. It's a lot of sodium. So pay attention to the times. Is it after you had a bacon biscuit? Is your blood pressure up then? Is it after you've been in the traffic and somebody cut you off and you've been fighting on the road with road rage? Is that when your pressure is up? So pay attention and kind of do a log. And then again, one of the ways to decrease the blood pressure fast is that slow, deep breathing. You can breathe for like 5 to 7 minutes and just really get yourself in the zone. And I've seen people's blood pressure drop by like 25 points. It varies from person to person, but getting yourself in that headspace, these are some things you can do to naturally lower the blood pressure. And then water drinking. You want to drink plenty of water. For most people, around 2 to 3 liters. Now, if you have a special medical condition like kidney failure where you're not producing urine or not producing much urine, then you'll need to restrict your fluid. And then if you have heart failure or lung disease, you'll need to restrict your fluid. So if you have these medical conditions, consult your physician about how much water. But if you have normal functioning kidneys and you don't have any major organ damage, you need to flush your body with plenty of water, 2 to 3 liters. That's 4 to 6 bottles, like 16-ounce bottles of water a day, or over at least minimum 8 of these little 8-ounce bottles of water. Try that and see if that helps as far as your body's fluctuating blood pressure. And again, check your blood pressure under the supervision of your physician. But thank you for watching it. Thank you for asking that question.
Thank you. I have a viewer, Zion, on with us. Hello, Zion.
Hi, Miss Zion.
Zion is hoping that these remedies will help naturally. I just took blood pressure. It's 197 over 112.
Okay. 197 over 112 is extremely high blood pressure. So you, with that blood pressure alone, are in a danger zone. Now, here's my question to you, Zion. At that blood pressure, are you having any headache, chest pain, shortness of breath, dizziness, anything like that? If your answer is yes, you need to leave this YouTube live, call 911, and go to the emergency room now, okay? If your answer is no, if you're not having any of those symptoms, that's not good either, because what that tells me is that you've been living with this blood pressure for a long time and that your body has compensated. Even if your body has compensated and you're not having symptoms, you're still having effects, because again, high blood pressure is a leading cause of heart disease, a leading cause of strokes. That is a danger zone blood pressure. And so for you, yes, you can do some natural remedies, but for you, that blood pressure needs to come down immediately. So medication is what I would recommend. Will the medication be long-term? I don't know. But again, you need to consult your physician immediately. And if you're having any signs of the target organ damage, you need to go to the emergency room now. But my answer to you is yes, natural remedies could possibly help, but you have to make sure you don't have any effects on your kidneys, your heart, your brain. And so right now, I want you to consult your physician, either go to the emergency room or pick up the phone, please, because high blood pressure is the silent killer. Oftentimes people have no symptoms, but then they can still have stroke. And I actually I'll just real quickly give you an example of a patient like that. Okay, so Zion, I hope that you're now off in consulting your physician. That's a danger zone blood pressure that high. Okay. I had one patient early on in my training. He was 33 years old. He was muscular. He was healthy. He went to the ER. He had a little fender bender, and he ended up doing fine as far as the fender bender. He had a little back pain, but his blood pressure was extremely high. It was somewhat like Zion's blood pressure, very high. He had no symptoms, no headache, no shortness of breath, nothing. They admitted him to the ICU, and I was talking to him about follow-up and medications and lifestyle and all of that. And he told me he did not need me because he had no symptoms and he didn't need a doctor. And so he ended up leaving the hospital. This is when I was at Georgetown. And later on, like months later, while I was on a different rotation, someone came limping up to me, someone who had weakness on one side of the body, a little bit of slurred speech, young man, handsome man, and was like, "Doc, do you remember me?" And once we started talking, I realized this was that same young patient. He'd had a stroke, no symptoms, but untreated blood pressure. So again, when you're dealing with blood pressures that are that high, up in the 190s, definitely with that diastolic over 100, that's not the time to start off doing natural remedies. That's the time to consult your physician, and you likely will need a medication to get the blood pressure down. And then ultimately, some of these natural remedies could potentially get you off of the medications, but you must control that blood pressure immediately when you're in that danger zone.
And when starting the natural remedies, you should continue your blood pressure medications until it's actually starting to go down.
And then even before you stop, talk to your doctor. Say, look, I've been getting these numbers in the morning. I've been taking, CoQ10. I've been taking hawthorn berry. What do you think I should do? And y'all talk about it. And then maybe they'll say, okay, cut the pill in half or stop this one particular pill and keep that blood pressure log. But again, do it under the supervision of your physician, because high blood pressure is too serious of a medical issue to just try to manage it on your own.
All right, thank you. I have PK back here for a follow-up.
Hi, PK.
Is Himalayan salt better than regular table salt?
That is a good question. Thank you for asking. So I have a lot of patients. I just use pink Himalayan salt. Or, you're not talking to me, Dr. Free. I want you to take a look at the sodium content of your Himalayan salt. And whereas table salt for a serving may have 590 milligrams, the Himalayan will have 560 milligrams. Still a lot of sodium. Sea salt, same thing, 560 milligrams. Now, these salts may be metabolized differently than your traditional table salt, but still you need to limit your sodium. And I know one thing with the Himalayan salt and the sea salt, a lot of times you can use a little less of these salts and still get the same taste as you get with more of the table salt. So in that case, it can be helpful to you, So if you require maybe just 1 dash of Himalayan salt, whereas with regular salt, you would need 5 dashes for the same flavor. In that sense, you may be getting less sodium, but still, whatever salt you're using, look at the sodium content and still keep it less than 1,500 milligrams of sodium a day.
All right. In your prior video that you did prior to this live about healthy habits, alcohol intake.
Ooh. I got a lot of people who sent stuff to me about alcohol, and they said I was messing with their alcohol intake. But yes, what's the question?
Well, some people say they are casual drinkers, maybe sip or drink.
Okay.
During the duration of the night, that some may say they had a drink, but the glass may be this tall.
Okay, let's talk about alcohol intake. So high alcohol intake can increase your risk for hypertension if you're drinking excessive alcohol. So for men, you should be drinking no more than 2 drinks a day. If you drink more than that, you can increase your risk for high blood pressure. For ladies, no more than 1 drink a day. And for men over 65, no more than 1 drink a day. So a lot of folks are like, oh yeah, I just took 1 good old drink and I drink that every day and I'm fine. Okay, let's talk about the definition of a drink. 1 drink is not a 32 ouncer of vodka. That's not 1 drink. It's very specific. 12 grams of ethanol is 1 drink. So in terms of wine, 8 ounces of wine is 1 drink. Okay. If you have a big old goblet of 32 ounces of wine, that's not 1 drink. 1 drink is 8 ounces of wine. 12 ounces of beer is a drink. And so I don't know how they serve the beer, but if it's a big old mug like this and you got your, 24 ounces of beer, that's not a drink. 12 ounces is 1 drink. And then it's that hard liquor. is that hard liquor where it's even a smaller amount because it's high concentration. So an 80 proof liquid beverage, like an 80 proof vodka or 80 proof whiskey or gin, 1.5 ounces is one drink. And so if you say you're having a drink and you're sitting there drinking the drink during the game or watching TV, make sure that it's a drink. So if it's wine, 8 ounces, and that's it. So one drink or less for ladies a day and men over 65, 2 drinks or less will help to keep you from being at that high risk for high blood pressure. And of course, if you abstain from alcohol, then you reduce that risk all the way as far as alcohol being a risk for high blood pressure. And folks, don't get mad at me. I'm just telling you the science. Shoot.
And you should always remember, of course, to, consult with your physician, or this is not a consultation here today.
Yes.
Just always follow up.
This is an informational video. Because if you know good and well your doctor told you can't have alcohol with your medications, or if your doctor told you have liver disease, cirrhosis, hepatitis, don't go to them and say, Dr. Frida said I can have 2 drinks a day. Please don't do that. Consult with your physician. And again, abstaining from alcohol altogether will knock out the risk of alcohol. But if it is okay with your physician for you to have moderate alcohol, then limit the alcohol to the definition of a drink that I just gave you, please. And don't be mad at me.
We won't be done. So you mentioned earlier in the video, if you stuck around, you have something special for the viewers.
Something I'm really excited about. I have a free download for you. And on Thursday, I actually want you to go and watch the video. I haven't even put the video out yet. But on 30, I have a video coming out on 10 healthy habits for a better you and a better life. And if you click the link, then you can get this free download of daily habits that will just change your life, that will help you. This is the download. This is the download. That don't look healthy and happy. I'm going to tell you, it's because I'm following these things. Everything that's in here, you'll get a chance to see all of the advice that I give. And really, it's 10 things, and you can run through them every single day. And I can tell you, I'm living it. I'm running through these 10 habits, including positive thinking, exercise, drinking water, and some things you wouldn't have even thought of. But it's 10 healthy habits for a better you and a better life. Please click the link, and you can download it for free. It won't get old, and it will help you to have a better you, better life, healthy you, healthy life. I'm very excited about it.
Oh, can I keep this copy?
You know what?
I'll download it. I will subscribe. My email is downloaded.
Look, now you got me looking stingy. I'm like, wait a minute. You know what? Yes,
it's very, very attractive.
Why, thank you. But it's good, solid information, all jokes aside, because it is my mission for everyone to have their healthiest, happiest life. When I say that, I promise you, I mean it. And we have so much control mentally, physically. We just have to believe in ourselves, to want it for ourselves, to take care of ourselves, not just other people, and just to educate yourselves, and we can have this healthy life. I'm trying to live mine.
Yeah, me too.
Okay. All right. Well, again, thank you for joining us on this YouTube Live. Please be sure to comment down below. And I've got more videos coming up. If you have any things you want to educate yourself about with health, please check out my other YouTube videos. And make sure on Thursday to watch this 10 Healthy Habits video. It's going to be a good one. All right. We'll see you next time. How are you trying to take my stuff, Shadora?